Welcome dear viewers to the video on delayed release formulations. These formulations are also known as enteric coated formulations, and these are also called as gastro-resistant formulations. So let's start with the video. Delayed release formulations. These are the formulations in which the drug release is delayed. As the name indicates, the release is delayed for some time as per the predetermined specifications. So there will be a lag time in which drug is not released from the formulation, and after that lag time or predetermined time, the dose will be delivered in the GIT. The release rate is designed based on the control of the release by time or site in the gastrointestinal tract, absorption and distribution of the drug required for the treatment. The delayed release formulations release the drug completely, like immediate release formulation after a specific lag period, and this lag period is because of the enteric coating, or you can say because of the delayed release coating onto the formulation. And once this coating is released, then the formulation will behave like a IR formulation. These are also called as enteric coated formulations, delayed release type of formulations, gastro-resistant formulations, and these are abbreviated as DR and GR. So whenever you come across a DR type of formulation, that means it is a delayed release type of formulation, and GR means gastro-resistant. Generally in the Europe market, these delayed release or enteric coated formulations are called as gastro-resistant formulation. The enteric coating or delayed release formulations are made for some of the specific APIs. The APIs which get degraded in the acidic environment of the stomach. So to prevent degradation of drug in the acidic pH environment of stomach, the enteric coating is performed. Then for protection of acid sensitive or acid labile drug, to prevent GI irritation due to drug release in the stomach. This is also one of the important reason for making the DR formulations. Generally, the painkiller APIs, you can say, or NSAIDs, you can say, these APIs are formulated with enteric coat so that the GI irritation can be decreased or prevented. The drug get released in the intestine because of this delayed release, and that's why GI irritation is less. The main understanding behind the enteric coating is that the drug will not be released in the stomach, and this will increase the possibility that the drug is released in the intestine and the therapeutic outcome will be there. If the acid labile drug is formulated into IR type of formulation, then the IR formulation will release the drug in the stomach, and because of that the drug may get degraded and impurity may get formed. So to prevent these things, delayed release formulations are made. To prevent impurity formation due to API degradation in the stomach acid, some examples are there like duloxetine. Duloxetine is formulated into enteric coated formulation. Then another reason is to target the specific site of drug release in the GIT or colon. For site specific local treatment in the GIT or colon, these type of enteric coatings are given to the formulation. Sometimes the ER cover, that is extended release type of cover of tablet, is coated with DR coat to get the site specific drug release. In some of the formulations, you can see that the DR coat is given to the extended release type of formulation, and these type of enteric coatings are performed to have the site specific drug release. The enteric coating formulations bypass the drug release in the stomach, and that's why these protect the APIs from being released into the acidic environment of stomach. DR polymers. So the polymers are of very much importance, and enteric polymers are used for the delayed release coating. These enteric polymers are pH sensitive type of polymers which does not dissolve or does not swell and erode at acidic pH, but these enteric polymers dissolve or erode at pH above 5 or in the basic environment, and that's why the formulation remains intact in the stomach, and once the formulation reaches to the intestine, then the release will happen. The examples of DR polymers is hypromellose, acetate succinate. Various grades are available for the HPMC AS. Hypromellose phthalate is the another example. Eudragid polymers are there with specific type of pH range. Polymethacrylic acid co-methyl methacrylate are also known as eudragid polymers. Then polyvinyl acetate phthalate and cellulose acetate phthalate. So these are some of the commonly used enteric coating polymers. Out of these, eudragid polymers are mainly used. Hypromellose phthalate is used and hypromellose acetate succinate is used widely. DR formulations may be made by making the IR core of tablet and then coating it with enteric coat, ER coat of tablet and then coated with enteric coat. Drug layered pellets or beads can be made and then these beads are coated with the enteric coating. So these are some of the examples of delayed release formulations. Generally, seal coating is required many times before the DR coat is done. So for example, take an example of a tablet. The IR core is prepared and on that IR core seal coating is performed, and after that seal coating the delayed release or enteric coating is done. The seal coating is performed so that the API in the core of the tablet can be separated from the enteric polymers, because these enteric polymers may interact with the API and may generate the impurity. That's why seal coating is done. Example of the DR formulations are commonly available in the market. Many of the rabeprazole formulations you can see, these are with the DR type of formulation design. Esomeprazole tablets or pellets are there. Omeprazole tablets and pellets are there. Pantoprazole pellets and tablets are there. Then duloxetine capsules are made with the delayed release coating onto the pellets of duloxetine. Then some of the non-steroidal anti-inflammatory drugs are formulated in the DR tablets and other DR formulations. The polymers play a very crucial role in the DR formulation design, because only the polymers are the excipients which are giving the delayed release property to the formulation. DR coat serves as a barrier to prevent the gastric acid entry in the formulation and also prevent the gastric acid in the stomach from dissolving or degrading the drugs. So these are the advantages and technology for DR formulation. There are some limitations also. So limitation is the dose dumping. Here also in DR formulation, dose dumping may happen if the delayed release coating is inadequate. The formulation may release the dose in the stomach, and that's why the DR release type of design will not be there. Then loss of delayed release characteristics, that means the dose dumping. Then acid resistance, failure to the acid resistance. Generally for DR formulation, acid resistance test is performed in the dissolution testing, and if it release the API more than 10% in the acidic environment, then there can be a chance of loss of delayed release design or loss of delayed release characteristics. So whenever the delayed release formulations are tested in the dissolution, that time acid resistance test is performed using the acid media for 2 hours or 1 hour for some of the formulations, and if that formulation releases more than 10% of the API in the acid environment, then there is a chance that dose dumping is happening or acid resistance failure is there. So if more than 10% drug is released, then it can be said that the loss is there in the delayed release characteristics of the formulation, and that formulation is failed in the dissolution testing. So these are some of the important understandings and key considerations for delayed release formulations. So whenever you come across a delayed release formulations, you observe those formulation designs, study those formulation designs, and also know that the delayed release type of formulations are generally taken on the empty stomach. Whenever doctor is prescribing you the delayed release type of formulation, then always read the instructions onto the patient information leaflet so that you can take your medicine correctly. Thank you for watching the video. Please do like, share and subscribe to this channel. Thank you.